Okay. Thank you. Good afternoon, everyone, to the People and Health Overview Committee of Dorset Council on the 21st of January at 2 o'clock. Welcome to everyone here, and I would like to actually welcome a new member of our team, our new committee, Julie Robinson, and I would like it minuted to thank Carol Jones that actually stood down from the last meeting. And thank her very much for her participation and input to our meetings in the past. So thank you. Welcome to everyone here today. I think it should be pretty well full house, except I think we're waiting for Louise Bone. She hasn't turned up yet, but she may. We've got Will Chakravarta on the line, I believe, my vice chair, he's there. And so instead I've got actually Andy Todd here, Councillor Andy Todd, to step up to be my vice chair today. So thanks to him. George, have we got any apologies? No apologies received. Number 2, declarations of interest. Now, I have a declaration to make because I am a trustee of the Purbeck Youth and Community Centre, which has been designated as a family hub at the Wareham Youth Centre. But I will be, I've decorated it, declaration on that one. But they won't take any action to actually step down or anything because it's non-pecuniary, and I will take part in the meeting. Kathy Lugg.
And Councillor Kathy Lugg from Ferndown. I'm a member of the advisory board of the Family Hub in Ferndown, but it's a non-pecuniary interest, so again, I will take part in the discussion.
Thank you. I haven't done this before, but I think it might be good to go round to all the committee members and say who you are and what your ward is, so that we've got all the visitors that are here and online know who we are. So I'm Councillor Beryl Ezard from the Wareham ward, and I chair this meeting.
Councillor Andy Todd, Coal Hill, Wimborne, Minster East.
Councillor Steve Mercer from Blackmore Vale ward.
Councillor Julie Robinson, Ferndown South.
Councillor Kathy Lugg, Ferndown North.
Councillor John Orrell, Melcombe Regis.
Councillor Stella Jones from Dorchester East.
It's working. Hi, Councillor Jindy Atwell from Coal Hill and Wimborne East. It's just wanting to do it.
Yeah. Thank you very much for all of our members of our committee, and we'll go forward. The minutes of the meeting are held on the 29th of October. Is there any anybody want to question any of the minutes? No comment so far for anyone. And we need to sign the minutes as a true and correct record. So at the end of the meeting, I'll do that. Number 4, public participation. We've had no questions from the public. So we go straight on to 5 questions from members. And yes, we had no questions from the members either. And there's been no urgent items for the agenda. So it's straight into item number 7, Family Hubs update, which we have a presentation by Rebecca Watson, Family Hubs Programme Lead. But I do think the Cabinet Member for Children Education, Councillor Claire Sutton, is online, I do believe. And if she'd like to introduce it for us, please.
Hi, Beryl. Can you hear me? Yeah, thank you. I don't really have much to say by way of introduction. It's a fantastic programme. It's going really well. There's one area that Weymouth and Portland is a little behind, but we're kind of on top of that. But I'm going to hand over straight to Rebecca, who's doing an amazing job on this programme. Thanks.
Thank you, Councillor Ezard. Good afternoon, everybody. Really nice to be here again. It was almost a year ago that we were here previously coming to you for a decision around the development of our family hubs and presenting our model and our planned approach. So it's really great to be here now to share an update with you on how things have been going and let you know about all the great work that's been happening out within our communities. So I've got a number of slides that I'll work through and then there'll be opportunity for discussion and questions following and really welcome your feedback and thoughts. So I'm sure most of you will have heard of family hubs now. Family hubs are emerging government policy and we've been working with the Department for Education as part of a grant-funded programme to develop family hubs across our county area. Family hubs are places within communities that provide information and support for families, children and young people, and that's for children and young people right across the age range, so from conception to the age of 18 or up to 25 for young people with special educational needs and disabilities. And the purpose of family hubs is to bring together services who deliver support and information for families, making it easier for families to access that information and support via a single access point. We know families still report that sometimes it can be quite challenging to know where to go to access that information dependent on what they need or the age of their child. So family hubs really aim to address that challenge for families, making it really simple and easy to access help and support when you need it. And that's help and support for all families. So families don't have to meet a criteria or be presenting with certain or particular needs. We recognise that all families need support and information from time to time. So family hubs are that place. And if you need a little bit more or a little bit extra over and above, we will connect you to that service and information to meet your needs, dependent on what it is that you're looking for. So as I said, we've been working with the Department for Education to deliver family hubs. And we're one of a number of authorities who have been asked to test and trial different approaches to the development of hubs across our council area. And through the grant-funded programme, we committed to open at least one family hub in each of our 6 locality areas. So through Children's Services, we operate in a locality model, and 6 localities make up the Dorset Council area. So we've committed to at least one in each locality, aiming to open 10 overall throughout the duration of the programme. So we see family hubs as a significant vehicle in which we'll deliver the priorities of our Strategic Alliance Children and Young People plan. It's very much part of our wider strategic commitment to our children and young people, and family hubs offer that real sort of physical mechanism to get that support and provision out there in communities for families. And I think most of you will be familiar with our Strategic Alliance for Children and Young People's Board, which is a strategic board with representation from across multi-agency partners. But as a sort of extension of that board, we have forums that are called local alliance groups that operate in each of our 6 localities. And what they do is they bring together people with an interest or responsibility for the provision of support for families in those local areas to come together, to share information, to share insights, and to work together to plan how services and support are delivered at that local level. And we've been working really, really closely with our strategic alliance groups as we've been developing our family hubs. And you'll see on screen here just a sort of image that depicts that structure. So we've been working with each of those local alliance groups on a locality by locality basis to think about what a family hub should look like in each of those areas. And the local alliance groups have enabled us to deliver on what's called an asset-based community development approach. So really looking at local areas and understanding where the strengths and assets lie in those local areas and how we can build capacity and develop provision, with those as our kind of foundations and our starting blocks to do that. So the local alliance groups have supported us in that process, and through those groups, they've helped us to identify where are those assets and who are those people in communities that we need to be working with and partnering to develop our family hubs. So the local alliance groups have helped us to identify venues for our family hubs in local areas, to engage organisations who deliver support locally to come together and start thinking differently about how we offer that support. They've helped us to share communications and informations with families in local areas, and they've been a great forum to allow us to build relationships and develop networks across organisations to help us think about how we can do this in a different way. And that's led us to a mixed model of family hubs in each of our locality areas. So no family hub is the same as its neighbouring locality. They all look very, very different. We have some that have been developed from community centres run by voluntary and community sector organisations. We have one that's being developed in a library space in Dorchester. And we have a couple that have been developed from what were existing children's centres that were already offering integrated provision for families with children under 5. So we've developed and enhanced the service offer from those spaces. Recognising some of the challenges that the rural nature of our county present for some families around access and transport to physical places and spaces, we've taken what we're calling a network approach to the development of our family hubs. I mentioned in a previous slide that we committed to open at least one family hub in each locality. Now, the DFE definition, the Department for Education definition of a family hub, needs to meet specific requirements around the type of provision and service that's available from that space. And that is what we've opened at least one of in each of the localities. But we recognise that that's not necessarily going to be accessible to all families. So we've taken what we call this network approach, which sees a hub and spoke or sort of satellite outreach type model. So we have main family hub sites that meet that DFE defined specification, but they're supplemented by a range of network delivery points. So working across libraries and other community venues to make a broader network of identifiable, accessible spaces within communities. And we define our network, as you can see on the screen here. A main family hub site meets the DFE definition of delivering the full range of services that they specify. And a network point is an identifiable place in a community that families can go and drop into for advice and support, and there will be some services delivered from those spaces, but perhaps not the full range of services that are delivered from a main family hub site. But that enables us to get out to more places and spaces across communities, making it easier for families to access advice and support. The next slide here, I appreciate the text is very, very small, but you will all hopefully have seen the report that you can see the appendix that contains this information. And this details a map of Dorset, our locality areas, and identifies where the main family hub sites are or will be, and the network points that are available within each of those localities. So I don't expect you to be able to read it off the screen, but do have a look in your reports as you'll see that supporting the main report. We've taken what I feel is a really innovative approach to family hub development in Dorset Council, and in line with our corporate priority around communities for all and working really, really closely with voluntary and community sector partners to deliver support and provision to our communities. We have taken an approach of partnering with voluntary and community sector organisations to take on what we call the role of lead organisation in our family hubs. So where there is an organisation in a local area that already has existing relationships with our communities and with the families and children, we've partnered with them to take on that lead role of delivering the family hub from the community space in that local area. And you can see on the screen here some of the organisations that we are working with across the localities who are doing an absolutely brilliant job in developing the family hub services from their spaces and building on that great work that they've been doing for many years in terms of delivering support for families and building connections and relationships. And we've partnered with them, learning from them what they know about their communities and how best to support families in local areas. So really, really pleased to see so many wonderful organisations on here, but recognising as well that we're continuing to grow this network. So we will be designating further hubs and network points, and we'll be growing this sort of list of partners that we're working with. That's a little bit about the family hubs in the building and the network. What I want to talk to now is a bit about what's available through family hubs. And where I mentioned specifications and criteria defined by the Department for Education earlier, this gives a bit of an indication as to what that looks like in practice. So the DfE have provided us with a list of service areas, 24 different service areas that they say should be made available through our family hubs. So a main family hub site should be delivering information and support under all of these areas that you can see on the screen. Some of them will take place physically in a family hub site, and for some of them it would be an assurance that if a family walks into a family hub that they can be well connected to the information and support on these areas. And what I've done on the slide here is just giving you an indication of what that looks like in a real family hub. So this is an example of the timetable in place at Wareham Family Hub, which is run by Purbeck Youth and Community Foundation. And this is just one of many of our wonderful family hubs, but hopefully on the screen here you'll get a real flavour of the types of things that are available to support families. And you can see here a real mixture of services and support for families of children with various different age ranges, but also services for young people themselves. So they're also places that young people can go into and access advice, support and activities in their local community. So this just hopefully brings to life what a family hub looks like and what's really going on. I hope you'll have started to see this branding out and about. This is some information and extracts from our Dorset-wide promotional campaign around family hubs. Now that we're starting to designate more spaces across the community, we want to start shouting about it and letting families know that they can access their family hubs. And so we've got some branding that we're using, and we're localising that in each of our locality areas and working with those partners that I just mentioned to really get messages out there to communities to let them understand how they can access this advice and support. In addition to the physical places and spaces, we've also developed a family hub online, and we launched that in the summer alongside a promotional campaign, and we've seen significant increase in access to that in comparison to previous years. So really, really pleased to be growing that platform for families that choose to access information virtually. For many, that's a preference rather than going in or speaking to somebody. People like to receive information in different ways. So we want to make sure that families who want to receive information via online platforms know that they can go in via the Family Hub and access trusted and ratified information and support. And we've developed our online content in partnership with a range of different organisations, including our colleagues from across the NHS Health Services, to make sure that the information that we're providing via those platforms is absolutely evidence-based, up-to-date, accurate, so that parents and families can be confident in what they're receiving. Just wanted to also touch on our children's centres, because as you probably are all aware, Dorset Council, unlike many local authorities, has maintained a network of children's centres over the years, delivering support and provision to families with children from 0 to 5. We've never made changes or reduced services from our children's centres because we've been absolutely committed to make sure that that community support is available. But with the introductions of family hubs, we've had an opportunity to look at our children's centres and think about how we can further develop our provision locally. So we are currently in the process of consulting with families and communities around some potential changes in some of our children's centres. We are doing that at this time because we feel confident that our new Family Hub offers an enhanced service for families. So we are not taking any provision away. We're just looking at how we're using our community buildings and making sure that we are using them to best effect. And where there's opportunity for them to use slightly differently, perhaps to develop increased early years provision where we know there's a need in a local area, we're recommending that we might make some changes to some of those spaces. That consultation's live, and I'm hoping everybody should have received information about that. That's running until the 21st of February, so I'd encourage colleagues to go and have a look if you haven't already and that you're interested to do so. So a little bit now about the future of family hubs. The government recently published their plan for change, and we were really pleased to see family hubs referenced in one of their key milestones. Giving the children the best start for life references family hubs and the development of the family hub programme across local areas. And that's been supported by an extension of the grant funding from the Department for Education into 25-26. So we have had confirmation that we will receive some further funding. It's not to the same level that we'd received previously, but that's in recognition that a lot of the transformation and infrastructure building has taken place already, and this is enabling us to continue to develop our offer. So pleased to see that, and we're just in the process of signing a new memorandum of understanding with the Department for Education around the use of that grant funding. But really encouraging to see that it's a continued commitment of this government. So what that means for us locally here in Dorset, we've got some plans for how we want to continue to develop our Family Hub network. And you can see on the screen here the key kind of deliverables that we're going to be working towards. Firstly, we will be designating our remaining Family Hub sites. So we have a few more sites. Councillor Sutton mentioned earlier our Weymouth and Portland hubs, along with a couple of others that we'll be bringing on board this year. We want to continue to grow our network. So as I said, those community delivery points where we can offer information and outreach services, we want to continue to build that. So we'll be identifying more opportunities to partner with organisations and places and spaces to enable that to happen. We'll be developing our partnership service offer from across the Family Hub network. You saw that list of 24 service areas. It's becoming really well developed in some of our hubs, and some of those that are just coming on board have got a little bit further to go. So we're working really closely with partners from across a range of organisations to make sure that we are delivering those 24 service areas, but also, and most importantly, that we're delivering services and support that meet the needs in the local communities. So starting to do some more detailed work to understand those needs and make sure that the provision is meeting them. We want to develop more robust mechanisms for user engagement, so starting to hear feedback from families that are accessing support and information and using that to inform our ongoing development. And we're also developing and improving our data recording and monitoring system so that we're able to capture data on our activity across our family hubs, who's accessing, how are they using our hubs, and what difference is that making, again, to support our ongoing development. So there are our plans going forward. That brings me to the end of the presentation, Councillor Ezard. I don't know if you want to open up for questions or comments.
Thank you, Rebecca. It looks really promising, and thank you so much for the update. I think there's obviously be questions from the members of the committee, but if we've got anyone else that's not a member of the committee that wants to ask questions, we'll take those first. So anyone else would like to? Steve Robinson, Councillor.
Hi, Steve Robinson, literally drivers in Upton Ward, adult social care portfolio. Just an observation question. Within adult social care, we're moving increasingly towards a hub and spoke model. So there's also within the NHS integrated neighbourhood teams. There's an awful lot of networks out there, and it's just really just a check to make sure that everything is working in step and in harmony.
I'll happily come in on that question. Alice Deacon, Corporate Director for Commissioning and Partnerships in Children's. And not to put it in a kind of a complete, but absolutely, the integrated neighbourhood work has been connected into Purbeck and is connected into Weymouth and Portland. Mark Tyson, who is my peer in adults, and I are connected around how we can work together in that space and how we can share learning across. And also we have seen the development of Swanage as a really, a hub that is a family hub, but is a community, a community across an all-age provision. So there is space for us to think more in there, how we do that, how we connect up the spaces and places so communities can move through, either if they're connected by being on the same site or if there are multiple buildings in a village or town location, how you describe those and the offer that comes from those spaces. And we're really thinking together alongside others across the directorates around how we take that kind of place-based approach and really focus that Communities for All agenda through some practice that's already in place in children's and might be looking to grow in other areas.
Thank you. It's Alice, wasn't it? Yes, thank you, Alice. That's great. We've got somebody online. I think it's Jane Somper. Would you like to ask a question, Jane?
Thank you, Chairman. I hope you can hear me. Super. Thank you for the presentation. And I was very lucky to go and visit a hub a few, actually it was before Christmas, and obviously I'm very aware of the family hub that is opening in Sturminster Newton, which is headed up by the very energetic Councillor Carol Jones, a true force of nature. A question on funding. So on visiting the hubs, my understanding is that they're not necessarily funded by the council, and they have to fundraise and apply for various grants. They may get some funding through from the council, but that doesn't cover the cost of everything. That may be different in different hubs. I don't know because I haven't been to all of them. So I wanted to understand the funding method and what that might look like for the future.
Thank you, Councillor Somper. And I know you've got another visit, I think, tomorrow, haven't you? I know some colleagues are going out to Swanage tomorrow to visit, which is lovely. So we, through the DFE grant funding, we have been able to fund our main family hub site. So where we're partnering with voluntary organisations, we've entered into service level agreements with attached grant funding to enable them to deliver and facilitate the family hubs from their spaces. Also in doing that, we've worked with them to look at sort of business modelling and thinking about opportunities to generate income through the provision of the family hub. So although the majority of services are delivered free of charge to families who are accessing family hub services, there is an opportunity to generate income from those community spaces in addition to delivering the family hub. So many of them will be offering community hire, etc. We are working with colleagues to think about the sustainability of our existing model and awaiting further government guidance around ongoing funding and support for family hub development. But it's a very live, active conversation. I think it's fair to say, Alice, I don't know if you've got anything to add.
Yeah, I'll just come in on that point. And Rebecca's detailed the work we're doing now and the work that's gone before. And the Family Hubs agenda is really interconnected with the work that we're doing as part of a Wave 1 Pathfinder in terms of the reform and how we also look to support our communities at the earliest point through the commissioning and support of organisations to deliver that early support piece. So there is a piece of work that's happening alongside the Family Hubs strand that is connected to other transformation and wider reform work in the social care space. So there is much to do with our future commissioning piece, and some of that links to Councillor Robinson's ask around what we might be doing in this space. So there are lots of future things coming online, including connecting the conversations with the integrated neighbourhoods and the ICB around what opportunity there is for joint commissioning, joint funding, etc. But we do have grant agreements in place for this year, this financial year, and we do have agreements in place across next year. So there's still much to do over the next 15 months with the funding we have. But I am expecting to be in a much clearer position as to what we're doing future-wise in terms of grant funding from this point in the next financial year, which would be, 2026.
Thank you, Alice and Rebecca. Can I just say that I think the funding thing is all, very well, but we're always thinking, well, it's going to end up on the edge of a cliff in a year's time. But we do hope that this government is supporting this Pathfinder and especially the family hubs. And I feel that they are going to, but it doesn't give us a really nice grounding on whether it's going to be the same, more or less. But I do hope that actually, as we have, like Rebecca said, we have been noticed in high places, and well done for that we are leading across the piece. And I think that is, all for the good. And I think if we can really make a good actually grounding and show other people that these pilot schemes that we're doing really work, then I think that is good for the whole country. So I think that we can go forward. We've got several other people asking questions. I think Will online wants to ask a question.
Thank you, Chair. Thank you very much, Rebecca, for your paper. I'm just wondering whether there is a north-south divide. So I'm minded to think that some of the people who access these services will probably be struggling with other challenges in life. So I wonder what support they get, especially to access these services, especially in rural areas compared to the urban conurbations.
Thank you. That's a really helpful question. Family hubs, although very, very much around offering access to services through places and spaces, are also about how we work better together across organisations. So we're also thinking about where there's opportunity to think about delivering differently, working with our schools, with our early years settings, and those places that families are going to, those kind of universal services and provisions that families go to, and thinking about how we can reach into those places and spaces to take advice, to take information and support, particularly whether those challenges around the rurality and accessibility. Our network model aims to address that somewhat, but we know there will always be families who will find it difficult to access support. So things like the Local Alliance Group, where we're able to bring together service delivery partners from a range of different organisations. That includes things like GP surgeries, social prescribers, schools, early years settings, together in one space to really think about what those challenges might be in local areas and think collectively about how we can address them, are really, really crucial to the success of this model, because it's not just about a place, it's about how do we work together to plan and deliver services to meet all. So it's an ongoing piece, but though I think our model and the forums that we have in place really, really support and enable that activity to happen, looking at that real local level need.
Thank you, Rebecca. Does that answer a question, Will?
It does that. Thank you, Chair. Thank you, Rebecca. Thank you.
Thank you. We've got now Steve Mercer.
Thank you, Chair. Rebecca, could I just go back to Will's point for a minute? So looking at the coverage that you have, you talked about 6 and it's going to 10 family hubs. And I see in your documentation the 2 to be confirmed, or whatever TBC meant in those, are Blandford and Central Weymouth. I am very conscious of Gillingham and Shaftesbury. Gillingham is a town that is expanding quite considerably. And if I look at their Gillingham and Shaftesbury's combined population, it's 21,000. If I look at Wareham and Swanage that have 2 hubs, their combined population is 15,000. And just picking up on Will's point, the geography, the gap between the Vale Pantry and Sturminster and Gillingham and Shaftesbury is a big one. Could I just ask a second question as well? In the budget papers that we looked at last week, it talked about family hubs saving in the order of £1 million. I went with Jane Somper to the one in Ferndown and was amazed by it. Could you just put some flesh on the bones? And I know this is not a financial audit or governance meeting, but where does that, could you just scope out that £1 million to give us the confidence that actually it will save those amounts of money?
Okay, I'll answer the first part of the question, if that's okay, and then I'll hand over to Alice. So around the sort of the locations and the geographics around our development, you're absolutely right. We know that the north locality particularly covers a vast geographical area, and our commitment to at least one hub in each locality, of course, means that there needs to be a slightly different approach across the north to make sure that we are, able to meet families' needs as best we can. So the hubs were identified, as we said, sort of using the asset-based community development approach. We brought together partners. We identified where there was existing opportunity to build. The Vale Pantry in Sturminster Newton is absolutely wonderful at providing outreach to neighbouring villages and towns also, as well as those families living in Stir. But we're also really thinking about those connected network points. So we're working with Gillingham Library. We're in conversations with the Rivers Meet Leisure Centre as well around the potential to deliver service and provision from those spaces. And we also have existing children's centre spaces in Shaftesbury and Sherborne that are offering services and will continue to offer services from those spaces. We're also aware of some development opportunities in those areas. For instance, a potential new community hub in Shaftesbury that we're thinking about, how we can take information and support out into those spaces. So really, really acknowledging that even if there isn't a main family hub site within a town or village or area, that there are lots of opportunities to deliver services and provision from existing community spaces. So we're confident that through our network approach, we will be able to get that information and support out to the families living within those areas as well.
I get that, but having been to Ferndown, and I remember the centre manager, whose name escapes me, but she was amazing. She told me that day they had 15 community groups meeting in that hub on one day. And the University of the Third Age they were packing the central hall out there, Kathy, which is not a small room, is it? I get that, but to have a centre of excellence like that, where you've got 15 groups going on in one place, to say you're going to put it in a library is a bit of a poor relation, isn't it? You've still got two more to place. Please put one of them up there.
Need an answer, but
I was going to come in on the second part and leave Rebecca to have further conversations about the development across Gillingham and Shaftesbury, because I think they're really key conversations. And, the pounds only go so far, but we do want everyone to experience the best offer possible. And as I know, having been there myself, the centre is phenomenal, and they have the best biscuits, Kathy. Okay, the transformation programme that the Family Hubs is attached to is part of the Children's Services 5-year transformation plan. There is £1 million savings attached to that programme this year, at the year we're sitting in, and profiled in for next year. Now, those savings are predicated on our ability to support our communities well, to therefore impact and influence our children in care population in terms of early support and the right support at the right time for families, helps them stay together, helps children be supported in their communities, and helps parents thrive. So that modelling has been done alongside the programme development and the proposals through the DfE. It's a combination of practice and rebalancing the system in terms of keeping our children in care population as under control as we can. Of course, we're a needs-based service. We have to respond to need when it comes in, but we have seen some fluctuation there, but a downward trajectory and a stabilisation. So this forms part of a key piece of work to continue to deliver services that are universal, so access for everyone. We will support that child if they are looked after by someone other than a parent, but will also support the family network and that community to develop it. So the savings are still big, but we have delivered those this year and will deliver them next year. And it's Rebecca and the programme team's job to keep an eye on those and also see where we can consolidate our assets, think about how we can reprofile things and really make that investment from the DfE do more and seek cost avoidance where possible. So some of it is cashable savings, and that's the million, and then there will be cost avoidance that we also look to consider as we continue the programme. And while they may say the Family Hubs programme isn't going to be funded beyond 2026, etc., what we know is the integration with this programme with Pathfinder and with all the other transformation work means that there is an absolutely solid foundation and model in terms of Dorset Children Thrive, and you've got the spectrum of need being catered for by that provision. So yes, ambitious target in terms of savings, but it also does, this programme is really yielding support, and you saw the footfall through that family hub, and the more we do that, the better the support is in the community. So long-winded answer, but many things are considered in the pot.
Thank you. What? Yeah.
So this is not my specialism, so I'm not, I don't have a great understanding of this. So it talked about in those budget papers, reducing the number of interventions will enable those savings to be made. I know all cases are different, but are you able to just to flesh out how much an intervention in a family with a child going into care, just a ballpark number as to what that might save, just so we can put it in the context of £1 million?
You could save £1 million with one child. Sorry, if they've got complex enough need, a placement cost that isn't in-house, that is a private provider, requires multiple additional adults in the space, it could cost us over an annualised sum £1 million. It could cost us 70, it depends. Some of our children are looked after by our own in-house residential services, but the market, and there's lots of narrative, there's been lots of work in this space around and I'm going to use the reports language, the profiteering of the private sector in terms of children in care, and the fact that we are beholden to market forces in a way that is not as it should be ethically when you're thinking about looking after children who are our highest need. So if I prevent one child coming into care, I can realise a lot of that saving target by having a good infrastructure. And I know that it sounds dramatic when I say it, but the figures absolutely speak for themselves, and Councillor Sutton will be able to add some of that now she's been completely indoctrinated into the space, that actually it is that significant, the amount of impact we can have on that. So we doing this work really diligently with families, trying to keep them together and making sure wherever possible we plan when children come into care, keeps those costs in a controlled way. And keeps our ability to control it, and anything we can do early to provide the infrastructure, and also the opportunity for a child to be cared for by a friend, a relative, all of that impacts on the cost to the local authority, and ultimately the highest context being that that child is being cared for in a place that is best for them. Hope that's helpful.
Thank you, Alice. I think she's done you justice there, Steve. I don't think I can have you come back again. But yes, I think you did very well there. We've got several other people. We've got Kathy next, please.
Yeah, as you know, I've been involved with setting up the first family hub, and ever since then, troubleshooting. We've come a long way, haven't we, since the first family hub? And we've solved a lot of the problems. One of the things I'd like us to look at now is the risk to the voluntary organisations and the people within that organisation because of the lack of information sharing. And I'm hearing about data protection, but safeguarding should trump data protection, I believe, and that doesn't appear to be happening. Our volunteers are taking quite a lot of risk because all they know about that person coming to see them for help, and quite often they're referred by our early help team, but without any information given across. They only know what that person tells them. And so the information they're giving them and the help that they're providing is tailored to what they're being told. Now, we know that the most complex of families, the ones with the highest need, don't always tell us the truth. And so that person can be at risk. We're talking about families that might take drugs or might have a history of violence, but that worker at that first point doesn't know that, and during that ongoing work, there's nobody to go to for advice. What I would like us to do is set up some sort of system to protect the workers, that there's somebody that they can go to who will say, well, I'm working with these families this month, and somebody will say, well, actually, we know about this person, and then they decide whether they will take it back in-house or give some sort of information out, because at the moment, I think, you know, they're taking the risk, not the council.
Thank you, Kathy. I'm not sure it's anyone here that can answer that one.
Response, yeah. Thank you, Councillor Lugg. And I've had some conversations with colleagues to similar effect. There are a couple of things that we're doing. We've been working really closely with our Children's Services locality teams and making sure that we have really good integration and relationships with those and the centre, and creating opportunities for more regular scheduled contacts so that those things can be picked up and addressed. And there's also some work we're doing around the development of our information systems that enable relevant and proportionate information to be shared where appropriate. So we have some developments in our internal systems that will enable that to happen. But I think key is that relationship and that support, and links in with the relevant staff across our locality teams, which we've really been trying to develop over the recent months to make sure that staff in the hubs feel really well supported and able to manage any situations that they feel they might be challenging.
Do you want to come back on that? Yeah.
It would be helpful in the meantime, whilst we're developing that, if there was a person name that, you know, Nikki from Ferndale, because some of our hubs are run by Dorset Council staff who already have access to that information, but our voluntary sector doesn't have that. In the case of the centre in Ferndale, they've got quite a lot of contacts already, but I'm thinking about other centres as well. And without putting too fine a point on it, there was a case recently where a family didn't give an accurate picture. This was picked up by speaking to an NHS worker who gave one tiny piece of information, which meant that everything else that family had told them was incorrect. You know, and that's the sort of risk I'm talking about.
Yeah, can I just say that there is always safeguarding, I think, and I know putting volunteers in jeopardy is not something that I would, certainly with my connection with the Purbeck Youth and Community Centre that has a the hub, most of the volunteers, they have done safeguarding, but they signpost families. They don't actually deal with the families themselves. They signpost them to one of the groups that actually are, specialist groups for families. So I think early on, it's just dealing with somebody and then saying, that's how you do it. But it is very important that we have this connection between those volunteers or frontline people that are actually just on the desk, as it were, aren't put in jeopardy. Thank you.
I'll give you a single point of contact, Cathy. He was going to answer, but I said I was going to, so I trumped him.
I think we'll go on to our next person. I think it's Claire that was going to ask a question, who's our cabinet member.
It wasn't a question actually, Beryl, and it's long gone by now, but it was to provide reassurance on a point that you made earlier, that I was in a DFE briefing for lead members just yesterday, and Pathfinder Family Hubs is absolutely, top of the agenda for children's services under this government. And I mean, Alice has answered this completely comprehensively, but also sort of adding to her response to Steve Mercer, it's all the mantra. It's all about the mantra of early intervention to prevent need escalating, obviously in the interests of the kids, but also in terms of managing spend. So yeah, that's all I wanted to add, really.
Sorry, yes, I think that was a statement from Claire. So we have now John Orrell, please.
Okay. Thank you. I'll ask some questions on numbers at the end, but a couple of observations. Having been around this area for a number of decades, about every 10 years we see the model change. It's gone from health centres when I started, then children's centres, then the Troubled Families programme, and now these new hubs. I actually want to applaud the previous administration of this council for standing firm against some of the national policy of the last 15 years and holding on to those children's centres, because that was inspired, because there was a lot of good that was done by children's centres. And in many ways, by holding out against the national policies, Dorset has prospered in its children's services with these hubs, with our own children's homes, which opened in my ward, bringing the schools back to Dorset. All of those are examples of bringing things back in. So we're not relying on private greed to provide for our children. We're providing on working together, particularly with the voluntary sector. So a big plus to our previous administration in doing that. Also, the second observation is that the relying on different organisations and having different models in each locality is great. It's you're building on people's enthusiasm and expertise. You're not relying on a one-size-fits-all model. So that's my second observation. Well done, twice. Now I come to numbers. We can question the numbers on money. Unfortunately, lack of money is a common theme in these meetings. My concern is that, the staffing numbers. Is it possible at some stage to know with the staffing numbers in the new model compared to what we've had over previous decades? So how many health visitors, health visitor assistants, school nurses, social workers, social worker assistants are there each year? That's one of my questions. I rather suspect that we're falling down on numbers. Having said that, this new model does make the best use of the reduced numbers, which I suspect underlie all this. So I'm not saying you shouldn't do it. I just like to know what the numbers are. And the second number I'd like to know is the outcomes. Across the nation, the outcomes for children are appalling in terms of dental health, obesity, immunisations, and more particularly mental health. We have the worst mental health in Western Europe among our children. What would be really not good to know is whether this model that we're applying in this county helps the mental health of our children. I hope it does. I suspect it will. But the question is, are we measuring that?
I'll do a bit on the numbers, and then I'll hand to Rebecca on some of the kind of evaluation, and I'll touch on evaluation. And I can't necessarily speak to kind of the healthcare professional aspect of your question. So I'll focus on children's services and social work and other qualifications. The work that has been done in children's services from 2019 through to now has seen you have a really stable, solid, early help and social care system. The invitation from DfE to engage in and be a Wave 1 pathfinder for social care reform has enabled us to enhance our locality model and actually invest in some areas, including additional targeted youth workers, some addition in terms of the connective tissue between early help and social care in that kind of SEND and inclusion space. So there has been an enhancement there through Pathfinder, not without, Councillor Ezard, the risk that you noted around the kind of long-term funding. We're not immune to the national challenges around recruitment, particularly in statutory roles, but we have a really good history and legacy in terms of apprenticeship programmes in both social care and now in youth work, and also now in the family worker space. So we have 3 apprenticeships to move people through into and continue to grow and learn with us and gain the qualification that they want to and is most suitable for them. So we do have a strong and stable system in terms of that resource. Like I said, not immune to challenges, and doesn't mean that we don't struggle with some posts, but we do manage to recruit well in most spaces, but there is a national shortage of social workers. The health space I can't speak to, and as you all know from the Cabinet papers that will be tabled on the 28th, there are continuing budgetary pressures for Dorset, and children's services will absolutely do their bit. We have done historic evaluation work on the Children Thrive model and on other things that have set us on a good train. There is evaluation funding from the DfE that means we have an embedded evaluation post that looks at Pathfinder, and there is evaluation work that crosses over into the family hub space around what outcomes we're achieving and what we're getting right for children. What we know about practice is our practice and the relationships that we form with families are strong. They tell us what they need. And when we were doing the evaluation of the Thrive model way back in 23, what Oxford Brookes found was the need didn't change, the relationship established, and then families told us what was going on underneath the surface. So we see a tiny tip when we first meet them, and then it's like an iceberg. Then you uncover the true need in there. And actually Pathfinder and the work that we've been doing with the family hubs and with allows us to work across that continuum and not move people through thresholds, but allow relationships to follow them. And that an example might be, I go to a family hub, I need some support, and I trust Rebecca. She's my person, but I need something more than her. So as we move further into this model and into Pathfinder, a locality practitioner might come alongside us and support our relationship, and Rebecca to hold that wrist rather than go, oh, sorry, I can't talk to you about your concerns anymore, but sit in that space with me. And that's the aspiration, and we're seeing some of that come through. The outcomes, the numbers in terms of what we're seeing, like I said earlier, the children in care population is comparatively nationally, we aren't seeing the growth in that population that other local authorities are. We are continuing to experience budgetary pressures in that space because of everything that I've already described. But we also can see that our early help, our early help families, I don't like the term caseload, our early help families, those we're supporting there, is bigger than the component parts of those who might be children in need, child protection, and child in care. And that's absolutely the way we want it. And that there'll be more that sits in the family hubs and in other spaces and places. So you see the biggest, it's like that, you know, that triangle. The tip should be tiny and then the universal bit should be big. So we know all of that. Our numbers tell us that. The national profile that we put that up against, and we measure it against our Southwest partners, we can see that there are good things happening in terms of where we're meeting need and how people are progressing or not progressing through the system. There's always more to do in terms of that articulation, and Rebecca will tell you a bit about what we're doing to make sure that we're evidencing the impact of the family hubs, and where we've got a practitioner shortage, how we might be supporting those partners that are with us to meet that gap.
Thank you, Alice. I think that was quite comprehensive. Are you happy with that, John?
Yes, very reassured. Yeah, early intervention, universal intervention, helping everybody rather than raising barriers and then only treating. It just makes things worse. So it's a really good model. Totally support it. Thank you.
Yeah, thank you very much, Alice. Very, very important that we've got you here, as well as your colleagues. I think that you know it is very tricky because families are difficult, especially when they're in a position where they're at a disadvantage. They always feel a disadvantage, but they're always going to actually show themselves as being not so at a disadvantage that they really are. But the thing is, what I would encourage members, if they're not already members of the local alliance groups, because that is something that actually is an eye-opener for me in Purbeck, because the local alliance group covers actually representatives from schools, from all sorts of ways in the community, that actually covers family hub situations as well. So a lot of information that I've gleaned has helped me to understand what family hubs are all about as well. So if you should have a local alliance group, and I think Rebecca may be able to help you with that if you want to join one. And they're about once a quarter, and they're supported with all their secretariat from Dorset Council. Yes. On the list, we've got Stella next. Thank you.
I think the family hubs is a great idea, and hopefully it will work well. But I have some concerns. I think the first is the one that Cathy raised about safeguarding. I've been on a lot of children's charities, and I know safeguarding is a very big issue, safeguarding and confidentiality. And hopefully we can make sure that all our volunteers are really up to date with the latest safeguarding. Otherwise we might have some problems in the future. And the second thing about using charities and volunteers is what we've discussed, is sustainability. Charities rely on volunteers, volunteers disappear, they also rely on funds. Fundraising is more and more difficult for all these charities, and we don't want to set up a hub and then have to fold it because the charity is no longer working. I think you've covered some of that problem. But also, the hubs are supposed to give 24 different services in different areas. How often are they supposed to give each service? Is it like once a month, once a day, every week? Because I go into Dorchester Library, which has a hub, and every day it just says what's going to happen for the hub each day. It doesn't give a whole list of how often these things happen. And how are we going to monitor what's happening and review back about how well these places are working? And then the last question is, how do we advertise hubs? Because I know people do not know where their local hubs are. People even running, I got involved in the children's charity, and those trustees did not know the Dorchester hub was up and running. We've got to advertise in some way much better.
Thank you, Councillor Jones.
This point that I know that I volunteer at the youth centre and also various other sort of places. And I noticed that the youth centre, now their family hub, will insist that all their workers there, whether they volunteer or not, are up to, is it grade 2 on safeguarding on children and grown-ups, not just children. So it is important, and you can go online and do that. So, and none of the volunteers will be front-facing unless they've done at the level 2. So that's important to know as well. Thank you.
Thank you, and thank you, Councillor Jones, for your questions. Firstly, picking up on the safeguarding. So there is some workforce development and training that's available to our family hub sort of lead organisations. So where we have an organisation that's responsible for delivering in a hub in a local area, we are providing support and training to them. And we're also linking really closely in through the local alliance groups. And there's opportunity to do something focused potentially in Dorchester if that would be beneficial. Bringing in colleagues from Children's Services to share information, talking through local sort of safeguarding procedures, accessing our front door for support to children and families, for professionals and families directly. So there's absolutely scope for us to do more if it's felt that there's a need in those areas. Just moving on to your question around the services. So there is quite a detailed document that the Department for Education have provided us aligned to those 24 service areas, telling us what the minimum should be, the minimum service offer. In many cases, it's quite broad. It just says families should be able to access or be connected to advice and information in that area. So we just need to be confident that those delivery partners and staff operating within the hubs have really good knowledge of local services and information and support and are able to make those connections. So there isn't necessarily specified times that, you know, health visiting must be available every day or parenting programs every day. But what we want to do is make sure that we're doing that in accordance with local need. So really thinking about what are emerging needs in our communities, how do families want to access advice and support, and how can we marry those two things together to make sure that anybody who has that need is able to access the information and support in a way that meets their need and suits their style in terms of how they want to receive that. So it's very flexible, but really, really thinking about what we know about our local areas and how we can develop services in accordance with those. Have I answered everything?
Thank you. If you notice in the papers, there was the Family Hub online. It's now available. And if you click on that in your papers, it comes up with the Family Hub, which actually you showed on the slides. So just give you all the pointers there about different areas that where to find the family hubs, childcare, pregnancy and birth, advice by age, keeping families safe, and then special education needs, support for families, activities for families, health and well-being, money and benefits, children's social care, professional supporting children and families in YouthLink, and you can sign up to get family news as well. So it's all there, but and actually it's up to the families and us to point it out to people to use that, you know, when they need it.
That's fine if you are aware of family hubs at all, but if you're not aware and you've got a family problem, it would be nice to see somewhere outside saying family hub to help with family problems, so that they could walk, say, into Dorchester Library knowing that there was someone who could advise them. Whereas if they don't even know they exist at all, they wouldn't go onto line to look about it. And I also asked about how we're going to review and monitor that everything is happening.
I asked Rebecca, is there any flyers anywhere in, you know, libraries and town halls, parish councils or whatever, that has been sent out to people to be able to distribute those or whatever? I mean, even clubs and pubs and leisure centres are very good for those sorts of things. Thank you.
Yes, sorry, Councillor Jones. In terms of promotion, we have a centralised communications team that sit within Children's Services, and they have developed a Family Hub communication strategy that we're following. So there are various different ways in which we're starting to get information out and about the Family Hub network. We have various different social media channels that we utilise. We have Dorset Council's web pages and newsletters, but we also do lots of work with our partners. So working with colleagues across health visiting services and midwifery, so that families from that very, very earliest point receive information on their family hubs. We've just produced something called a Start for Life offer, which explains to all new and expectant parents what they can explains what they can access by way of advice and support in those early years, and talks very much about family hubs. That's going to be going out to every new parent whenever a child is born over the coming months, so that we can make sure that they get that information from the very earliest stage. We also work very closely with our schools, with our local alliance groups, but as Councillor Azar said, it's really, really helpful if we can take that approach collectively, and we ask colleagues here in the room today and online to help us and support us with that messaging as much as we can, because we know that various different ways of getting information out is the most effective. People receive different information and choose to receive information in different ways. So if we can take a multi-pronged approach and a collective responsibility to do that, it would be really, really welcomed by us as the central team, because I think it's really, the voices of colleagues in these rooms out within communities is really, really powerful and important in getting those messages out. In terms of understanding how the hubs are being used, and sort of the impact of that and the uptake of the hubs, we are developing a new system which will enable families to register with their family hub. That will be whether they use it online or whether they're using a hub physically, so we can start to track the volume and take up of different services to help us with our planning, but will also enable us, just going back to comments from earlier, to understand families' experience and the outcomes and impact of them using hubs as well. So that's going to be implemented within this next quarter. We'll be introducing that system, and that will really help us to understand how our hubs are being used and whether we're reaching the families that we want to be.
Rebecca,
can I just ask, could we as a committee have a review perhaps every 6 months about how they're actually working?
I do believe we have a review annually, is it? Rather than 6 months?
It's been a year since we came last time, so I don't know, George, if that had been agreed formally or...
Well, it might also be a role for the scrutiny committee going forwards as family hubs are developed and implemented, and then the progress of family hubs and the impacts that they're having, it would be monitored by scrutiny rather than overview.
Does that answer the question? Yes, that's good. Yes. Important that, yes, it is scrutinised later in the year. Switched off again. Sean, your colleague online, wanted to say something. He's got his hand up, so should we let him have his say?
Thank you very much, Chair. I think Rebecca has very ably answered it, but just to say hello to everybody. I'm Sean Holhouse. I'm the practice lead within the Family Hub team. Can you hear me all right? Yeah. Just particularly around Dorchester Family Hub, obviously it's a co-location with our library service. There is some work going on that I've been doing with that team, and it's work in progress. One of the things that is work in progress is actually just getting a really clear sign outside the front door. So just to reassure, that is one of the things that we're doing. We're also doing some development actually as you walk into the library and the Family Hub. So you've got a group of both Family Hub practitioners and also library staff, and it's really clear and a nice warm welcome where you've got people who can signpost people upstairs where the main Family Hub rooms are. So there is work going on there, and we're also doing work with the midwifery team as well that will hopefully be coming into that hub as well. So it is work in progress, and I suppose that's the thing, it's how we get that understanding of what services we've got there and then promoting it, and it's both of those things at the same time. It's an iterative process. It's not all there yet. There's work to be done just to reassure people around that, and in particular in terms of getting a very clear sign outside the front door that it is a Family Hub. Thank you.
Thank you, Sean. I'm not sure we caught that, everyone, but it got better. So Alice wants to continue. Thank you.
I can pick it up with you, Councillor Jones, outside. But one of the things Sean said is we need to get a sign out the front that says it's a family hub, and work collectively with libraries to make sure that there's a very warm welcome across, so people really understand that it's an integrated service offer in terms of family hub and libraries. But work in progress, especially for Dorchester. Yeah.
Thank you. We've got one more person, I think. We've got, yes, Andy alongside me here, not to miss him out. But before I ask him with that, I think the registering of families might be counterproductive. Will it not actually, have some people that really don't want to do that? And so maybe not, isn't there other ways of monitoring people that click online? I mean, there must be with the, the way of things these days, rather than have them register. I just think some families may not want to do that, and so it'll be a deterrent. Yeah, that's my thoughts on that. Just an observation. Yes, Andy, thank you.
Councillor Andy Todd, Coal Hill, Wimborne Minster East. Thank you very much indeed. Knowing this was coming, I have actually used as a customer the Wimborne Community Hub just recently. Most recently, I responded to an email that was sent out to us inviting us to a health check. And so my compliments to our colleague, Adam Morgan, who was exceptional, very professional, very diplomatic. Can we look at getting him a new tape measure? Because I've been 5'10" my entire life, and now apparently I'm not. But excellent. So thank you very much indeed. The problem with coming probably last is that everything that I wanted to say has probably been already said, and I apologise if I reiterate anything, as I'm definitely going to do. We are not oversight, but I did read the report, and I did notice that there is a distinct lack of any sort of concrete timelines, milestones, measurable goals in there, which immediately made me want to know. I'm sure Steve will agree with me. It simply makes it easier for us to track the progress and to see where the weaknesses are that you might need additional resources. And it allows us to prioritise. So that's my first issue, is if that's possible, even if it's not for us to see it, at least have it available for council to review. The second point is anybody who's been involved with any sort of charity work knows that charities made up of volunteers, the enthusiasm of the volunteers waxes and wanes. People come and they go. I worry that there will be a diminution of the service being provided by any sort of volunteer service, and that may vary across the county. I worry that there is some differences between the resources that are available in each area, and I worry that the accusation of, I hate the phrase, postcode lottery may arise if we are not carefully monitoring the offering that we're providing county-wide to make sure it's equitable. And the final comment I will make, just to keep it short, and again, I'm reiterating what Councillor Jones has already said, is advertising. The Wimborne Family Hub is located next to the Wimborne Rugby Club at the moment. One wouldn't know. Certainly not in a way that would communicate with the audiences that's walking past it on a daily basis. I do wonder sometimes whether we use the resources that are available, not necessarily the ones that are most likely to get a result for us. So I did wonder whether when we look at facilities, whether we are looking for the simplest solution rather than the most efficacious solution in terms of buildings and so forth. That's, as I say, I'm reiterating things that have already been said, but thank you very much.
Could I come in on that final point? And one of the things that there are timelines and a project plan and lovely Gantt charts that sit behind all the work that we presented today. One of the things that has sometimes pushed the deadline or pushed the timeline is the seeking of the right place. Portland being, all of them have had significant time and attention. Portland has had really significant time and attention because that community really needed some work to restore some of that faith and trust in community, in that co-production of where would be best for that community. And we've seen that in other places and spaces. And for places like Purbeck or Ferndown, they are the centres where the community have said, I already come here. I want to orientate myself here. I trust the people who deliver, and I trust that my needs will be met by those people in terms of that voluntary sector organisation, and it might be a combined offer between the locality, so Dorset and the voluntary sector. And that's the key, I think, and the beauty here is that consultation and the mixed economy that is there, that does have some risks in terms of the sufficiency and ability, but also beauty in the fact that I could come in and say, right, locality team, you go and land yourself next to Wimborne Rugby Club. You know everyone, you know what you're doing, but actually that local alliance group, those local people, those local organisations have the trust and hold that community in a way that sometimes us, as even the best practitioners in the world, can be viewed as a little suspicious, and that actually, oh, look, social care have moved down the street, rather than that lovely organisation that I use. So it's about getting that balance. And there will be times where we've had to choose a building that if we had the money, we would have built it 20 metres down the road and in a beautiful new house, but we don't have that gift. But I think one of the things around this approach has been the opportunity to really steep ourselves in that need locally and really think, okay, how do we meet and how do we come together to think about what we're doing? And we're not at the end of the journey, nowhere near, because in order for this not to be trumped by another policy paper that comes out in 5 years' time, we also want Dorset to really see the benefit of this and say, well, actually, that's applicable to that new practice or new policy that's coming down the line, and we can just onboard that through BAU because we're delivering it through our family hubs or whatever else. So there is an opportunity for us to build a resilient infrastructure that supports people really well. But hopefully, we've managed to land most things where people need them, but there's always scope to do more. And if we can, if I find more coins or people give me more opportunity to apply for funding or be alongside voluntary community sector organisations to apply for things that's going to give longer term stability, then we'll absolutely do that wherever the opportunity knocks.
Thank you. And do be aware that with these family hubs, it's not run totally by volunteers because, with the money that we've been given for each hub, you can take people on that are expert in their field and specialists that actually deal with these different parts of the family as they're coming along. So they're not actually, they are employed rather than actually as volunteers. So if they're employed for 2 years or 6 months or whatever it is, they are then committed to that job. And so it's not come and go as much as you think. The front-facing people that may be just by the front door to welcome people in may be volunteers, and those change. And I know at Wareham now we've got the food bank there, so we've got lots of volunteers doing the food bank, but it actually does bring in extra families and people that don't realise, because we're stuck behind the main upper school and right next to the sports centre. So people don't think that we're there in lots of ways. We've got big signs up at the gate as you come in. We've got big signs there right by the door as you go into the sports centre. It's to the right. It's attached to the sports centre. So, I mean, it is difficult to get the message across to people. But if you've got something like a food bank or something that people realise that they need, it's amazing how extra people do actually then access whatever's going on. And we've got a club there, over 55 club, so not so young youth club on a Thursday morning. And that's been growing and growing. And people come in, do all the things they used to do in the 50s and 60s, you know, which is great. And I've been along there and I don't want to leave. It's my sort of age. So it's those sorts of things are there as well. So people don't realise until they turn up sometimes for something completely different that they realise it's there. I mean, we've got the Duke of Edinburgh there as well for teenagers. And it's just amazing how families, even attached to those people, know of people that are in need. So it's actually a big sort of thing if you've got lots and lots of things going on in one centre, that it brings people in. So I would say if people aren't anything to do with the food banks or, you know, centres or youth centres and these family hubs, do get involved. It's amazing. And I do thank Rebecca and her team for putting together such a very good paper and actually answering all the difficult questions today. I don't think we've on the list at all. Anyone else that wants to ask any questions or at all? No, I think we've actually done that. So thank you very much for everyone. It's only a support for this paper. It's not really deciding on anything except, isn't it good that we've got this and we are being recognised by the government that we're a pilot scheme that's going forward. Thank you so much. I'm taking a breath. Steve. Microphone on where?
It's on. It's fine. Yeah.
That's, oh, I see. Sorry. Yes. Was there anyone else online that wanted to say anything just before we finish? No? Okay. Well, we now move on to the work programme and forward plans. I think, does anybody have any comment on those? No? And no exempt business, so we've got nothing, so that there's nothing planned. That in accordance with section 100A of the local government to exclude any public, but we haven't got anything, so sorry about that. And yes, we don't need to do that. And now that's the end of all the business, and thank you very much. That is now 15:28. At the end of the meeting. Thank you all for coming and have a safe journey home. Thank you.
Thank you all. Take care. Bye-bye.